I wish to first of all extend my respects to all of you, in particular Shri Murugappa, Shri Vellayan, Ms. Srimati Arunachalam, Professor Srinivas, Mahesh, and all the esteemed guests here. And I really thank, and I'm overwhelmed. I'm asked to deliver this esteemed lecture. And I'm trying to go over with you some of the issues that are challenges with dealing with long-term neurologic disabilities, specifically that starts in childhood. One of the problems with disabilities that start with childhood is that the disability grows with the child, unlike those that start as an adult. So you have to, in addition to dealing with the disability, you have to deal with the phenomena of growth and how it impacts in many ways, physically, functionally in different aspects. And there is a phenomenal amount of impact on society, the government. And if you really look at, in this day and age, human resource, the person is really one of the greatest resources, and we cannot waste. We have to try and work harder to improve disability in childhood and take care of them. I'm going to start off first with, this is our medical center in Jackson. It has, it's a level 1 medical center capable of dealing with all kinds of medical problems, including we have an extensive neuroscience program. Unlike Chennai, this is a city of just 500,000 people, and our main business is government, and the other business out there is medicine. My relationship, or actually the Chennai-Jackson connection, has been been there for many decades. A couple of my colleagues, Dr. Mecheri Sundaram, Subramani, they're all from Madras, and they have a good connection with Madras and with Dr. Srinivas and his group. First, I'm going to take you through what is disease. Now, this is the Oxford English Dictionary, which describes, I'm going to read it, as an impairment of a normal state of a living animal/plant, or of its parts that interrupts or modifies the performance of vital function, and is typically manifested by signs and symptoms, and is a response to environmental factors, specific infective agents, so on and so forth. It looks like a big legal definition, but nevertheless, this shows you that disease comes from many different aspects, some inherent in yourself, some from the environment, some from agents that you don't want to be in contact with. One of the consequences of being good at treating disease as such is that we create disability, which is a physical/mental condition that limits a person's movement, senses, or activity. So in one way, you could say the disability that we are seeing, especially in children and so on, is really a consequence of being better in reducing mortality. My objectives is really to take you through what are the different types of neurologic disabilities, just to sort of state them. I'm going to focus more upon cerebral palsy because of my experience in dealing with this, being a person who deals with muscle disease and nerve disease. I'm going to look at what are the challenges of cerebral palsy throughout one's life as an adult, as a child, as an adult, and then as an elderly person. We're going to look at what are the significant steps forwards that we have made in medical management, principally in the area of spasticity, seizure management, abnormal movements. Talk about some of the alternative therapies and complementary therapies. You heard quite a bit this morning's session about a holistic approach, not be just focused on allopathy as being the main goal to achieving relief, but rather we'll briefly talk about, and then challenges, which is of how does it impact how one gains access, the effect of aging, and how can we do further in terms of preventive strategies to help improve this condition. Now, childhood neurologic disability Amongst them, the way I see it is one of the principal big one is cerebral palsy, followed by mental retardation, groups of epilepsies, autism spectrum disorder, and then you have a variety of neuromuscular disease, all of which sort of impair motor ability, cognitive ability, and to various extent. What is the extent of cerebral palsy? Now, this is statistics from US CDC. If you look at chronic disability in a group of patients, polio, we have about 1 million people who still suffer from consequences of that. This is as a consequence of prior to the pre-immunization, where, and then cerebral palsy comes as a next second one at 764,000 individuals, spinal cord injury, and so on and so forth. So it is a sizable problem in terms of people who are disabled in the population. About 500,000 children under 18 have the diagnosis of cerebral palsy, and about 2 to 3 children who are born out of every 1,000 will develop cerebral palsy. So the measured numbers these days is that it's 8,000 to 10,000 and if babies born at any time will end up with this problem. That is a sizable number, and it is a sizable economic burden for any community or any society to bear. So what is cerebral palsy itself? Well, cerebral palsy is a poor term. In our setup, we don't use this, but it is in common lingos used fairly commonly. It's better to describe them as static brain disease or static encephalopathy. What this really means is that you had an injury to the brain, which occurred at one point in time. It's not one of a continuing process. It leaves residual deficits, which is your disability of various extent. Motor-wise, we describe this as diplegia. I have an example, which means your legs are weaker than arms, so you have abnormal ability to walk, but your arms are relatively preserved. Quadriplegia, which means all limbs are severely or quite significantly impaired. And then the others where there is abnormal or intrusive movements which interfere with your ability to use your limbs in a purposeful manner. The common cause, which still is a big one, is prematurity and its consequences, followed by problems that occur around birth, which is ischemic injury to the brain, infections to the brain as a baby, strokes, malformation, so on and so forth. So this is a picture which shows how the brain would look in a quadriplegic cerebral palsy child. Sorry for that. Where there is multiple cysts. This child has suffered severe hypoxic injury and has consequently ended up with severe loss of nerve tissue, which are replaced with cysts. Whereas this is the more common, what we call as the diplegic cerebral palsy, where you see the white matter is involved, which really controls the limbs more, so the ones that control the limbs are more affected than the arms. So this is what we see, and we have exquisite imaging ability these days to really know this. And when you look at these kids, this is how they look. So they can be, some of these kids who are pretty cheerful, playful, full of energy and vivacious, can walk around and play with those little walkers. And then you can also have another quadriplegic child who needs care for just about everything. Here he's in a stander, trying to get him in a standing position. One thing that we commonly do, and which several people end up doing, and especially in society, is to underestimate the ability of people with cerebral palsy. These people, because of their motor limitations sometimes, which also limits their facial expression, they can be construed as being mentally handicapped, challenged, retarded. And so this is a quote from Charles Dickens' David Copperfield: "Try not to associate bodily defect with mental defects, my good friend, except if you have a good solid reason for it." It's well spoken, and we see this quite often in our common setting where these people go for a job or for some employment, and quite often they say, oh, this person is not going to be able to do much given the physical inabilities. So how does cerebral palsy cause disabilities? Well, there are 4 big components that I kind of consider. One is called spasticity, which is stiffness in your muscle. Quite often it can be associated with weakness of various degree. Second is epilepsy, which can be life-altering. Third is cognitive abilities, have trouble in school, be challenged in many ways, and then movement disorders. Now, this morning we have already kind of covered many issues about how cognition, impairment, and epilepsy cause major issue. I'm going to focus what have we done about spasticity and motor abilities. So what are the problems that cerebral palsy gives? In children, parents often recognize that their children haven't reached their milestones. So they haven't kind of learned to walk, learned to talk, so on and so forth. Sometimes some young parents are quite anxious, and they think that there is a time clock in the baby's brain which tells them exactly when to happen. So there can be some latitude in terms of, but one of the principal ways by which they get picked up in infancy is by delay in milestones. Other problem is their muscle tone is abnormal, which means they become stiff, they can have painful spasms, seizures quite often to variable degree, and then delay in language and social skills. As they become children, their difficulty with ambulation becomes very obvious, and that's how you learn to address them. Learning and schooling issues, we had an exquisite discussion about it, how it causes major problems. Behavior issues, can be sometimes in children who are high functioning, or behavior issues who are children who are low functioning. Children who are quite mentally challenged can have aggressive behavior problems, biting, chewing, spitting, and hurting others, bumping their heads to the point of getting subdural bleeds. So it can be a major issue and sometimes challenging to manage. And lastly, feeding and nutrition. This could be partly because of the way they want to do it, or due to problems with swallowing and chewing and texture-related issues. So that produces secondarily problems with being malnourished and impaired, and thereby the other consequences that go with that. As they get older, you have to deal more with how do you ambulate these people? How do you get them around? Now, you can use wheelchair, and we're going to talk a little later. Behavior is another issue. Imagine a mentally challenged individual from CP who functions at about, say, a 6 years, who lives in a body of a 25-year-old. It's quite challenging for the family to work with that situation. Now, sexuality is an issue, both in the challenged child mentally, as well as in those who are physically challenged. So at some point in time, it comes up and we have to address. The worst thing to see really is a mentally challenged or a child with cerebral palsy be pregnant because of being exploited sexually and not having addressed that. And this does happen, and it's a tragedy to the whole family and to the society. Secondarily, orthopedic issues that are commonly a problem with aging becomes much more frequent, has a tendency to occur at an earlier age with cerebral palsy. So these people survive into 30 and 40, you start seeing problems that you would anticipate and see in people who should be, say, around 70 or 80 years of age. So one of the challenges that is coming up in what we call US and in European healthcare systems is how do you deal with cerebral palsy and there's challenges in the aged. There's very, very limited information that's available. Most adult physicians are extremely nervous to deal with who look like a child but is an adult. Imagine having to deal with a 25-year-old adult who weighs, say, 40 pounds. It's frightening, and to see them with a small head, small limb, and with a mother carrying them, and that deal. So intrinsically, our training as yet has to address this. How do we What happens when these kids become 40 or 50, their caregiving parents are there no more. And that does happen, and I've seen that it's a difficult situation. There is more features of accelerated aging, so things that you describe as you get old seems to come on much earlier. So they have more problems with fatigue, exercise, lack of endurance, more pain, aches, weakness, and also age-related health issues, hypertension, obesity, diabetes, osteoporosis, arthritis. The common kind of a bundle of things that go with aging starts at an early age, and also is much more difficult to manage at that stage. Let's look at what is the cost of dealing with all of these. Now this is, the data is rather limited, but this is from the MMWR from 2004. This is published by the CDC every month or so. And the direct costs that come from cerebral palsy, this is the group of children who would be diagnosed for the statutory year 2003 is $11.5 billion. And amongst this, there is a loss of productivity, that is loss of human resource, that is a big chunk, about $9.24 billion. And then you have the rest, 1.175 related to healthcare. So really the direct healthcare related expenses, not the big chunk, but the loss of ability to work, premature mortality, all of these account for significant economic. So there is a reason for society to look at this, that this resource is being wasted if we don't take care of them well. So now I'm going to talk a little bit about on the positive side, what have we accomplished in terms of cerebral palsy? Now we have done quite a decent job in terms of taking care of spasticity, which is muscle stiffness, which impedes in some people with their motor skills. So the first thing that comes up is, for general people, spasticity is an involuntary and abnormal muscle contraction, which then limits the useful muscle to do a useful kind of function. And thereby it limits people's ability to ambulate or sit comfortably and so on and so forth. So the question is, why do we treat spasticity? It improves people's function. You can walk, you can be more comfortable sitting. It decreases deformities. It makes care much easier. Imagining you have to change somebody's diaper who has his adductors so tight that you can't spread it out. Feminine hygiene in a teenage girl with severe cerebral palsy producing spasticity in their thighs. So there, it becomes a matter of good hygiene and good care. Reduces number of surgical procedures needed to keep them from becoming severely contracted. Overall improves their cardiovascular pulmonary health, and also thereby reduces hospitalization and survival. So there's good reason really to treat spasticity in a meaningful and aggressive way if needed. We call spasticity is localized, which means this phenomena is limited to, say, one arm, one leg, or one side of your body. Then we can use these methodologies with therapy, casting, injecting the muscles to make it looser with botulinum toxin, and then, of course, also surgically. Now, if it is much more severe, we have made some strides. We are now using, besides oral medications, more extensive, more severe, it's more generalized. We have started using methodologies which will reduce spasticity without making you too sleepy. One of them is to infuse the medication directly into the spinal fluid itself, is to use intrathecal baclofen. The principle here is that you, instead of giving the medication that has to go all over to your nervous system, you target it specifically to the spinal column, which is the source where the spasticity finally is generated. So who are the good candidates for this? Those who have severe spasticity, which is causing complications with their joints and bone, and is medically intractable. It's approved for children over age 4. They have to be clinically stable. What that means is you have to only use this, say you don't use this, say, in a child who's had a head injury of a recent origin. You generally give them at least about a year's time of adaptation and to recovery before you consider doing it. And of course, family's role is critical. They have to be motivated and be willing to participate and take care of this. This is one of the cardinal papers from '93, which shows that this is an effective way to treat spasticity, and it also improves function. What this graph shows is this is the spasticity curve. This being high and this being low, it shows it kind of declining along with, this is the dose over a period of time. It made, amongst the group who could walk some, it improved their walking in significant number of them. And those who are non-functional, it improved their ability to be cared much more easily. We use this and we do this quite a bit. In our center, this is the data which shows that it is effective in the first 50 patients. It shows that their scores of muscle stiffness drops after they get the pump. And this is the satisfaction score from the caregivers in terms of quality of life. You could see that there is an impact in how it improves feeding, dressing, positioning, transportation, general comfort, pain, and also it improves their impact on family quality of time in terms of how they can play with them, interact with the kid. Makes it much more easier not to have a spastic doll rather than child who's limber and can work with them. So overall, this is generally accepted now as a good treatment for spasticity when it's severe. Additionally, we revived an old operation, which is dorsal spinal root rhizotomy, which is you go and cut nerves in the back of your spine because the input that comes from muscle and joint is what drives the spasticity. So you go and interrupt the fibers that send that information. Thereby, you make the muscle be much more looser. And here's a picture in the operating field. This is a spinal nerve root prior to being just excised by the surgeon. And this is quite effective and quite useful, especially when you want to give good relief and comfort and improve care and positioning in contrast. And it's easier, it is much more cheaper, much more easier perhaps in countries where follow-ups are much more difficult and and medical care in providing in remote areas can be troublesome. Rehabilitation is an extremely important. It still plays a major role in these kids along with medicine. It includes stretching, weight bearing, cryotherapy. Inhibitory casting is a method where you cast the cast the good extremity and try to make them use the impaired extremity, sort of like driving, because it's been used, it's kind of, the data is not very strong. There are some who believe in it, many don't. Vibration of the antagonist muscle, pool therapy, biofeedback, stimulation, positioning. Well, in all of these methodologies, there is no clear information that one is superior to other and also how effective it is. But overall, if you look at it, they are in general, most of these are generally not very harmful. So in my opinion, or my approach is, as long as there's no physical fear of creating a secondary injury, I generally allow them to do it. And this is generally for most, and there is increasing acceptance about using alternate therapy. One other thing that you probably are aware of is botulinum toxin. It's used for numerous indications, including for cosmetic, which is perhaps the biggest and the most advertised. But it is quite an effective tool in spasticity. It works at the level of the neuromuscular junction and is effective in stopping the impulse from getting to the muscle. And it's quite elegant, and it can give you relief for several months. It's fairly easy to use. Now, really, everybody who comes to talk to me, parents, usually they want to know how can they regain function? How can they get strength back? How can they make it back so that the nerve can work back? Of course, the final answer is to replace the injured nerve cells. And that's one of the things that is currently in a big issue and topic. Stem cell therapy, it's for both even a neonatal brain injury as well as in adults. The principle here is that you take stem cells, which can be obtained from multiple sources, starting from fetal tissue, or it can be obtained from blood, bone marrow, umbilical cord, and using certain growth factors, you can make these cells to become neural progenitor cells, so that if you put it in, they will only become nerve cells and not become some bone tissue or liver tissue in your brain. And this has been done, and there are some good, elegant studies in animal models where it's quite effective. There are still many questions in humans. How do we deliver the cells? Do we directly inject it to the brain? Do we send it through blood vessels? Do we give it in as a bone marrow transplant? These are yet to be worked out, and people should be very careful because there are many charlatans who are at this time trying to exploit these desperate folks by giving them stem cells of various resources and without much effective results. Now, mobility is another major issue that has to be paid attention to these people, especially when their cognition is reasonable or normal. Equipment is critical. Making them mobile improves their self-esteem, their ability to get around, and the equipment that they need is based upon their strength, their age, their ability to understand how to use it, and also the cost and affordability that the person or the system can bear. You cannot give everybody the Cadillac. You don't have to. So that always is a thing that has to be, so the doctor becomes an individual in a way to decide who needs what. Great. So here's an example. Here, this kid is a diplegic child with a cast in his feet, and he has a care walker. He's quite effective. He can get around. And then there are these very substantially expensive, runs about $60,000, $70,000, more expensive than a luxury vehicle, which can do a lot of things, including lifting them, positioning them, and getting them around. They are perhaps useful in some limited, but this child does not need this, and that sometimes becomes a conflict with families. Now, one other thing that is undergoing a lot of research, especially in the past decade, is an ability to use brain as an interface to make the muscle to do what the brain thinks it needs to do. And using high level of computation, people have managed to get some EEG waves. I'm not really an expert in this, but that can then be modified into electrical signals, which will make your muscle to contract in a meaningful way. This is sort of getting into the first phase where there are some bioelectric models for, say, a limb, but it's not been still come in a big way, but it is going to happen with increasing ability to do better computing. And then this also provides a feedback to the brain so that you know exactly what you did, whether you accomplished what you planned to start with. Now, that's fine with everything that we talked about, that these wonderful medicines and others, they all are expensive. And also all these therapy, they're all expensive. Gaining access is a critical factor in all society. And one of the big issues is how do we get this? So you don't have to do everything. This is sort of a simplified way by which you could look at. Everybody does not need everything. Look at their function, decide what they need, and let it be appropriate. Involve the family in deciding what they need. So the family would say, this is what I need. This is what is the most difficult task I have to perform, and then have an appropriate remedy for that, and not have one prescription fits all. Fitness is an important component, exercise, so that they have better muscle growth as well as improve their cardiovascular health. Fun is important. It should be interesting. It makes absolutely no point in putting a child through an exercise regimen which is dull, routine, because I cannot be on a treadmill for more than, say, a week. When my wife pushes me, I have to do something else. And then, of course, friends are important, and you should also try to focus on these. Now, in order to improve the accessibility, this law was passed in 1990, Americans with Disabilities Act, so that all public or all institutions which get federal funding should have accommodation for disabled individuals. It is done quite a bit, so most of the government offices and other public resources in the US, you will find ramps for wheelchair. You will find access to in bathroom with in the sidebars, bathroom where more than one individual can get in, family-oriented bathrooms, things like telephones, feeding, and so. But it is being modified again and improved. But it is a step, but it still doesn't fulfill all the role, but it's significantly better than what it is. This also is a big help for, say, folks who are physically, or what I mean is motor-wise handicapped, but mental-wise pretty smart, to have their needed modification at work, say at a computer terminal or otherwise, to be done to accommodate them. So I saw, when I was preparing this, I saw on June the 2nd, in Times of India, there was this article which was said that schools may not be able to reject disabled children in Bangalore, apparently this reporter. And again, I find that this addresses somewhat similar issues, that children with handicaps should be provided with accommodations. And these are all the different disabilities that apparently is being covered, which is really a good forward step. Now, once we do all this, as they get older, we have to deal both with aging and also the growth of cerebral palsy with age. It increases pain, it decreases ability to walk. 25% of people with cerebral palsy who walk as a child lose their ability as they get into their middle age. That's quite a substantial number where you have to help them. Dental issues, trouble with eating and swallowing, being either overweight, underweight, hypertension, osteoporosis, arthritis, all of these are major issues, and the physicians, especially the generalists, should be cognizant of these and be better prepared to deal with them. And the things that affect our life expectancy in these people is the number and severity of disabilities. So more the joint problems, say one limb versus four would be worse. Restriction in mobility, feeding problems, seizures, and one important thing is respiratory function. These folks can have variable amount of problems with breathing because of chest deformities, and can have the secondary complications from that, and that has to be addressed too. So we can improve the life expectancy by improving their aspects of mobility, managing spasticity, making them independent, improve their social life and peer interactions so that they are, gain and maximize their ability to communicate, manage their seizures, and optimize feeding and pulmonary function. And of course, services are better if they're provided in their home. These are things that will be good. Having daycare for especially children and then older kids. Respite care, imagine a family where parents have to be with the disabled screaming child 24/7. For them to get a week off is a big relief. A short-term respite to do their other chores. Home health services, feeding, mobility, all these have to be sort of, again, society should address this in various ways and see how they can help them make it. And lastly, government support is critical. In our setup, there is Medicaid and Children's Health Insurance Plan, which covers cerebral palsy and disabled children who can live at home. There is supplemental security income for the family, so the parents get some extra money so that they can spend more time, or sometimes a mother can go for a part-time work instead of a full-time. Nutritional assistance. Also, there's all sort of assistance with energy so they get more power, housing assistance, but I don't know exactly what is the status here, but these things definitely help. But one thing that we do see, and even in our setup, is that as soon as they become adults after age 21, many of these services drop off. So the young adult with CP is a very vulnerable population as yet, and they're not being taken care of in a proper way. And finally, I want to close with strategies to prevent. I'm going to look at this from a perspective of cerebral palsy. So most cerebral palsy are as a consequence of prematurity. So do everything possible to have a healthy pregnancy, prevent teenage pregnancy, have good prenatal care, and then improve neonatal care so that complications that happen can be dealt with and you don't get secondarily get additional brain injury. And then also pay attention to immunizations, especially things like meningitis, so that you don't get. Early detection is critical, along with a holistic approach where you involve the family, the society, so that you can find that a significant number of these can be productive individuals at the end. And I thank all of you for giving me this opportunity, and specifically to Sri Murugappa and his associates, and thank you very much.